now, and you should be good to go.
All right, I'd like to start the meeting, the Brookfield Board of Finance regularly scheduled meeting for Wednesday, March 13th. Let's open it with the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, anybody here for public comment? Seeing none, we'll do communications first.
Okay, we had emails on February 16th, February 21st, and March 6th from Andy Correa, 45 West Wisteria Road.
Okay, perfect. And next, the approval of minutes.
I move that we approve the minutes of the February 21st regular meeting, the March 5th, 6th, and 7th special meetings. I'll second.
Perfect. All in favor?
Aye.
Aye. All right, motion passes. I'd like to make a motion now that we move to the budget part of our budget, general budget discussion, or the budget workshop items, and we'll start with what Marcia has lined us up for. Do I have a second?
Second.
All in favor? Aye. Hmm?
I don't get the vote.
No, you don't.
Put my hand up.
All right, Marcia, you're in charge.
Okay, so first we're going to talk to the health department, and they are here. They made some promises last year, and they're here to follow up on those promises this year.
Yes. For those that we never met, my name is Aaron. I am the Director of Health.
Tracy Cahill, I am the Environmental Health Specialist.
Last year we requested a full-time sanitarian, assistant sanitarian position, and thanks to the Board of Finance, they gave us a position, and we thought that we do a presentation for the commitment. I think it tells a good story, and there's lots of numbers that speaks for itself, and we'll go from there. Can you go back one? Oh. Yeah. So, this is our department staffing right now as of 2023. After we got the assistant sanitarian position approved last year compared to 2022. Now, I believe that we are fully staffed. That is committed to what our responsibilities are, and that fulfills what we need, in my opinion. And I think we're lucky for the team that we have, and also the town. So I'm the director. We have senior sanitarian full-time who has been here for 15 years. Tracy Cahill is the environmental health specialist. So we changed the title a little bit because of the new requirements by the state. We have a Dr. Solomon, who's our medical advisor, and Noreen, who's our admin person. The newly person that we hired is Tracy, who used to be our public health nurse. She was interested in that position. She was the one most qualified at the time, and it was a good move for us, and we're lucky to have her, to be honest with you. Next slide. So this is pretty much Tracy's accomplishments, and we thought this is very important because of the time frame and the achievements and accomplishments she actually went through in a limited time frame. It's not likely to be fully certified or where she stands now within that time frame, which started this last July. She completed 50+ online microbiology courses and the food inspector certification, phase 1, phase 2 subsurface sewage certification, lead inspector and assessor certification, and required by the state of Connecticut the food inspector training officer training, which covered it by the grant, the funding for it, because we had to hire someone, and that was approximately about 40 hours. And finally, the final food inspector field standardization, which also the last requirement by the state, is already scheduled for this coming up month. This is pretty huge for what she has accomplished for the time frame. So thank you for that, Tracy.
It's a busy year.
Yeah.
Lots of learning.
So these are pretty much what we were required as responsibilities, for starting from septic, private well, food protection, temporary food events, housing related issues, childhood lead poisoning, public pools, daycare establishment, body care establishment, which includes nails, tattoo, massage, and others. Environmental health complaints and blight. We categorize subsurface sewage, which is septic systems, in different categories: soil testing, plan review, field inspections, and building permit applications with septic review, which are required. Next slide, please. This is a comparison slide, which tells a good story. Our numbers for the septic are almost equally even compared to last year, maybe a little slightly higher. This is just a graph that shows a visual comparison. We can go to the next slide. In 2023, so in 22 we had challenges, and the 23 was a big progress. We did caught up on permits of discharges are being issued on timely manner now. Our new full-time Cherry C, who's assisting with finalizing as-built and progress in the progress with other items that are on hold, conducting more follow-up inspections. Progress is being made by updating files as permits requests are received. We continue to work on an education campaign, currently utilizing social media, phone conversations, and meetings specific to septic, because our residents are kind of lacking the education portion of it. These are just numbers for the 2023. Last year we had about 21. This year we had 19 private well application, dry well applications. It wasn't higher, but it wasn't any much lesser either. For food protection program, which is one of the biggest programs we have, what we do is we inspect and regulate every type of food establishments, from restaurants, institutions, retail markets, mobile internet vendors, temporary and seasonal food and events. We do investigate citizen complaints about unsafe or unsanitary conditions. We actually by law obligated to follow up each complaint, true or false, regardless. Investigate allegations of any contaminated food or foodborne illnesses. We do get involved with food outbreaks as well. We haven't had any, luckily, thank God. Provide food safety information to establishments and public. We tried that really hard this past year, where we're trying to get involved with our establishments and business owners to provide more information and education with the new regulations that passed on. We also do review facility plans for new and remodeled food businesses. I'm not going to read all this. In the year 2022, we had about 101 food establishments, and today we have 104. There were a few that closed and a few that opened, so it kind of balanced out of each other. By that, we are required to have 267 inspections annually. That's a state requirement. It is almost impossible to have 100% compliance, but we will love to get there eventually. We achieved 190 food inspections this year compared to 85, which was last year, and we had 27 temporary food events. Next slide, please.
Hold on, before you go. Yeah,
Sure.
go ahead, ask your question.
Sure.
I just see that the amount required is 267, so
Sure.
is there an issue that we're not inspecting as much as what's required?
Yes, load of work, limited resources, and at the moment we're doing catch up. We were down about 32.5% last year, and to our math we're about 71% as of now.
That's why we granted the position, Brian. So what they came to us, they showed us that red number last year, and it rang a bell with all of us. And Aaron came to us and asked us to give him the help, and he would bring that number up. So now he's brought that number up from 85 to 190, which is tremendous. It's still probably not where you'd like to see it. I can see where your math
I like
is going.
267.
Yeah, we do too.
Yeah, it's
What should be for
um,
2024?
I think the realistic number would be to be realistic, rather than bluff or just make up numbers. To maintain that 71% or within 70s would be really realistic. It is hard to maintain it. The reason is because there's new businesses coming and go, more complaints come and go. We do a lot more educational stuff because of new regulations that are new requirements, which is time consuming.
What's the implication of not meeting the DPH's requirement?
There isn't none. There isn't any. Sorry.
If we were
Just-
very low, the state would not be happy with us
Correct.
and would be, looking to us to improve our numbers. I think the next slide will speak a lot to some of your questions.
And 32.5% maybe would be okay by the state because of COVID at that time. But if we had 32.5% now, we would be struggling with complying with the state. To be honest with you, currently we may be the town or the department that has that percentage compared to surrounding towns. That's including Danbury, Newtown, New Fairfield. I'm very confident of that. But if you can go to the next slide. Right now we're 71.2% compliance compared to last year, which is 32.5. That's total 119 increase in annual inspection compliance, what we have achieved. I think that speaks for itself. And this is a big consideration, which is she's not licensed currently. She will be certified as of next month. So this was achieved between me and her going to do inspections together because she also needed to get a in-house training, which is required. And we had one car as well, and it was limited at the time too. There was times we didn't have access to a car, but with what we had, I think in my opinion, we accomplished big things. And that's the truth. So yeah, we did accomplish 119% increase in food inspection compliance compared to 32.5%. This obviously does minimize foodborne illnesses and outbreaks, food service establishment complaints, and unsanitary food establishment settings. Housing complaints, we had 31 complaints managed in the year 2022. At the moment, we have 53 complaints managed. This is just for the year 2023, January to December. This increase is due to additional rental properties, hoarding, and other mental health related issues that has been increasing throughout the town.
Are you also working with the mental health specialists and social services?
We work
Yes,
really
we
closely
work very
with him.
closely,
With Ryan
and-
almost day to day
Yeah.
with Ben and Ryan, yes. Public pools, we have 18 public pools. We are required to do an annual inspection with them. We did complete all 100% compliance. And we actually did more because we had also 7 additional re-inspections that we had to go back and conduct. Daycare centers, we have approximately 20 establishments who are in some home daycares and some daycare centers. So on average, that's just pretty much standard, same as last year. 10 inspections annual is the average. So we're fully compliant with that as well. Salon and body care establishments. We have a total of 45 establishments. This year we were able to do 100% compliance compared to last year, which was 66% compliance. So there was an increase of 51.5 compliance in percentage. Reportable diseases, I'll have her speak to it. She gets more involved in that because she also plays the role of public health nurse at the same time.
So this is a pretty comprehensive process. Now that we are a full-time health department, we have full responsibility for the reporting and case management of all kinds of reportable diseases, from STDs to Lyme disease to tuberculosis. And we don't get a break anymore because we are a full-time health department. So whereas the state used to chip in and help, they are still there for support, but the onus now falls completely on our department, and it keeps us very busy. It's very time-consuming. There can be cases that take a couple of weeks to resolve, depending on the nature of the illness. There are reporting requirements, there are contact tracing requirements, there's partner contact requirements. I work with the physicians and with the individuals to make sure that we try to mitigate any further transmission of these types of diseases. And you'd think Brookfield is a somewhat small, sleepy town. There is a lot going on. So this is something that takes a lot of our time. 51 cases may not look like a lot, but 51 cases is weeks and weeks and weeks of work.
Next slide, just to continue some more. Lead paint inspections, there isn't much of changes other than a few new requirements, which is, obviously time consuming. I mean, we're not complaining about it, we're just, presenting it. The rules did decrease to 3.5 micrograms per deciliter for blood lead levels. For that reason, we are responsible and obligated to send notifications, educational information, along with initial letters that's generated by the state.
And for an example, we have a lead case going on right now. It's been going on for a month. Very, very
more.
comprehensive case.
Yeah.
There's a child with an elevated blood level, which is risky. Whenever there's a child involved and childhood illness, it's very important. And we have to work with the homeowner. We have to do a lot of testing. We have to send them to the lab. We have to retest. We have to make sure that the child follows up with the physician. It's a very complex
Time-consuming.
process.
But important as well.
Yeah.
This is a number that's once again gives a good important story. The left column is the one from last year, exact, nothing has changed, and the right one is from 2023. Last year we had a total of 365 inspections completed, and today we had 650 inspections completed, and those are the categories. I'm not going to read all of them. We had increase in plan review or decrease in plan review application, which is $299, but it wasn't a huge difference. But we did have increase in number of plan reviews, including from private well and septic. And we did have increase in of soil testing, which was 49 soil testings last year, and it was 71 this year. Going back to the output category. Going from 365 to 650 inspections completed, that's about 78% increase in total inspections. And soil testing was about 45% increase in soil testing compared to last year. So this tells us the story. Basically, we got busier as well, but we were able to comply because of this extra position that you guys were able to provide for us. So overall activities, when we do put all those inspections and follow-ups into each activities, last year we had 907 total activities. Today's number, or 2023 numbers, was 1,214 total activities. Overall, that was a 34% increase in activities. So I do feel comfortable saying that we had a 34% of increase of workload compared to 2022. And this number in red, it doesn't include any emails, follow-ups, meetings, or those little things that sometimes time consuming. It's not included in that. Health Department revenue, in 2022, we didn't have much. But overall, we were able to get a few grants. The biggest one was a workforce development grant, which we were awarded $462,000. I believe we did receive that money. We do also have the lead paint ARPA grant money, which was awarded for $11,440. That's a reimbursable grant. And the PHEP grant. This is the first time that first year that the health department, Brookfield Health Department, is fully contracted with the state for the PHEP, or emergency preparedness responsibilities, and we were awarded $8,002 to be spent June 2024. That is a repeating grant that we will apply, and we should be able to get more than $8,000 next year because we started the year in July, and assuming we should get about $14,000 when the new fiscal year starts. The important thing with that is basically that covers our medical advisor's salary. So we should be able to cover that salary for the future years as well, as long as we have this grant. And it also covers our phone bills for the department, which is about $900. Same thing that will cover year to year moving forward. So that will be a repeating coverage. Overall, last year we had $75,920 money that we brought as a department from fees and other things, and this year we were able to achieve $85,655, which is about $10,000 in increase in addition to grants. So in total, we pretty much brought close to $7,000 in additional funding for the department compared to 2022. Our accomplishments, assistant sanitarian position was filled in July 2023. She completed all the requirements for septic. We did noticeably increase in department workload capacity, and numbers does speak for that. Currently, I think we are fully staffed. We do have 2 full-time phase 1, phase 2 sanitarians at the moment who can conduct any septic plan or project. We did have 119 increase in food establishment inspection compliance and 51.5 increase in body care establishment inspection compliance. Overall, 100% fulfillment of reportable diseases responsibilities. That's very sensitive, so we always do try to comply with that 100%. As a result, continued effort to raise the bar for public health in Brookfield to elevate the standards in food safety and expand the scope of environmental and community health responsibilities, which equals a safer and healthier Brookfield community. And we're including that as well, so. That's it.
Thank you.
Any questions?
No questions, just comments.
Sure.
Actually, maybe a question. I think what you've done is amazing. I'm blown away. 2 is, these are establishments our community uses, right? This is core to us, all of this. And I think, alluding to what Brian said, and you feel fully staffed this year, you were new last year, you 2 have got your feet going now, you've gotten good traction. I think you start looking at next year's budget, not this one we're talking about now, the one following, as in what percentages do you want to achieve after you've achieved it 2 years in a row? Like you achieved 70% now, what's the next level to get to what you think 80% or is 80, whatever your thoughts are to take it to the next level and see what we do. You've taken the help we've given you and you've utilized it. Steve, I don't know.
Yeah, you know, some of it is very variable. For example, this lead case that they have right now, it's required a few dozen hours. When you get people who are not as cooperative as you would like them to be, and you have to bring in other resources, these things can really eat up a lot of time. And protecting the child is number one.
Right. Oh, we think it's a success story.
Yeah.
I think
So
what Brian was saying is how do we take this success story and take it to the next level?
Yeah.
And I think what you alluded to in your question almost is, what do we, since you came in your first year, you did what you said you were gonna do. Let's get through this next budget. Well, we're getting through this year, but let's get through this next budget. But in the process of next year, if we wanna raise that bar to 80% of inspections, what do you need?
With the same budget.
No,
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 Okay.
no. What can we do to help you?
Well, let me say this first. What we have accomplished is truly since July, because she came on board in
Right.
July.
Right.
So the achievements that we have started in July instead of January. The numbers indicate, or the date is indicating from January to December. So coming up this year, we should be more than 71% when you think about it. Especially the fact that I can do inspections, and when she starts doing inspection next month by herself, now we would be able to do additional inspections.
Is
How-
there
so
a
you-
town
so
vehicle?
you-
You said that there's a
I
limited
was
stock
there,
every town vehicle.
town
Is there
vehicle.
one
So
available?
we were, thanks to Marcia and
So
First Selectmen,
let me just level set a little bit.
Sure.
So you're comparing a whole year to 8 months.
Yeah.
Correct, in a way.
Right.
It's a
So we're-
success story. That's what
yeah,
we're saying.
yeah.
We're
It's
on
what I said.
board. It's a success
That's
story.
what I said.
If
It's gonna
you
be
showed
much
us
better.
that chart,
Yes.
June 30th, 80, whatever, the
Yeah,
numbers would be
absolutely.
up even higher.
Yes,
Sure.
yes.
I just
Yeah.
want to make sure
And
everybody understands we're
what
not
I'm
comparing
indicating. We
year
should
to
be
year.
able to get it to higher once she is fully certified, starting next month.
Next month.
However, I do track my numbers, and if there is a need, I will knock on your door, for sure.
We'll knock on
And
Marcia's
it's
door.
not, and I truly will say this, it's not because we would want to, it's because of a need. We will, and with the car situation, we did get a police car that was used, and that works fine for now.
But it still means that we can't be out doing
Correct.
things separately.
Separate.
We have.
Because we currently have 2 cars right now, and we have 2 sanitarians, which is her and Paul. And myself, I just don't like to sit in the office. I like to go do inspections as well as much as I can. So and that also supports these, you know, our staff. So therefore, we would need a third car, but when the time comes for that, like I said, I'll knock her door first and then yours after.
Is there like a
We have been
folder?
using BK1,
And we,
Right.
yes,
then who gets to use the car? Then you're organizing,
Exactly.
having to reserve it and things like that. So I haven't used it at all,
correct.
BK1, but these guys do need a car. In my opinion.
So last year we did ask for a car, it was denied. We did ask for it. There's a new car this year is denied. It was denied, but we got a car now that's assigned to us permanently, which was a used one.
Let's see how.
Last year we were able to do these inspections because we did make an agreement with the previous first selectman, and we did use BK1 most of the time. But it wasn't 100% because if social services needed to go somewhere, it was more urgent than ours, and we gave the car to them. Or if somebody else did, we shared it.
Okay.
But in reality, we would need a third car, which technically will be just one additional car compared to year 2021. Because in year 2021, we did have a full assigned car to the health department. One was for the previous sanitarian, Lisa, assistant sanitarian, and the other one was for Paul. So right now, we're at where we were at because we do have a 2-car now. Does that make sense?
All right. Anything else you want to show us then?
No, when
is that-
Aaron and I got out of our meeting last year with all of you,
Yeah.
we made a goal of 75%, which we thought was
Yes.
unreachable.
And there's-
And we worked
there was a
really,
gentleman
really
that
hard
asked that question.
to get to that number. And, you know, just because of things that crop up and things that become more urgent, but 71% I can say we're very, very proud of.
Yes,
We've
we are.
worked
Oh, it's a
really, really hard
success.
to get there.
Don't
And
discount it.
we won't stop at 71.
It-
We're
And
not,
but as Steve said too, you're only at 80% of the year,
Right.
right?
That's correct.
Yeah.
Yes.
Time to
And
go.
considering that she wasn't fully certified, we
right.
did the inspections
Yeah.
together.
Yeah.
If you didn't
Um,
make it, you're still a success story. This is a
Thank you.
success. Call it what it is.
Yeah.
Take the credit.
we do, yeah.
Good. You should be proud.
Thank you.
I think we all did it at the same time. You guys gave us a position.
Yeah,
We
we're
committed to it, and I guess we delivered it.
Yeah. That's how it's supposed to work. All right. Thank you for your
That's
time.
Thank you.
Thanks, guys.
Thank you.
Cool. Thank you, guys.
Thank you.
All right, well, that was very nice, and they've made me feel bad because
No,
I
why?
have told Dan, don't do a presentation, and I don't
Oh,
want
sorry.
Dan to look like a
No.
slovenly compared
Hey,
to that.
no,
and-
no.
Honestly,
presentation's good.
I put my notes in my original request, so I figured pretty much everything should be clear. I figured tonight would be any questions you
Good night,
had
guys.
specifically on the individual items. I know my operating budget was up, I think about like 1.3%. You could see between the lines, a lot of it was moving from, say, the software line to communications. The majority of that was when we went to our new Microsoft licenses this year. Some things that had been licensed separately as software were rolled in on the communication side. Other than that, you could see on my budget form itself, I had little notes, each of our vendors that had, what a 3% increase, a 10% increase per vendor, each line, I put a note on there so we could see basically most of the increase has been driven by costs on the outside.
So, the big increase, there was 2 reasons that he's here, is operating, and that was added by the first selectman's budget with a new configuration. And then the second one is a next priority form. We had several next priority forms. There was one on computer replacement that has gone through to the Board of Finance. So, Steve, do you want to talk about the configuration with the Board of Ed? Have we
Yeah.
talked about that enough?
So, I think we've discussed this briefly, but not in detail, and I have discussed it with Dan. 4 years ago, when our head of IT retired, we made a decision, based on her advice, to try to go with one IT person. And it worked very well. Dan's done a great job for us. Over those 4 years, the amount of work, the amount of, things that Dan has to face because of cybersecurity and things like that has grown substantially. In addition, it became clear to me over the last 2 months I've been here that we have one person responsible for the entire town. We have no bench strength. In this day and age, God forbid Dan gets sick or breaks his leg and can't be in for 3 weeks,
there's really nobody to replace him. Okay, we can find somebody. Eric will always come over and help us, replace cartridges, things like that. They don't know our systems that we use in depth. So John Burrell and I had talked 4 years ago about merging departments and putting our resources together. We have done that with purchasing, and it's worked really well. And I think we've gotten more than our money's worth out of hiring a purchasing agent, and the partnership has worked really well. We have a memo of understanding there. So we discussed the structure of what we would do, and what we thought we would do is have Eric, who is the head of IT for Board of Ed, become the overall head of IT for both the town and the schools. We'll pay about 20% of his salary, because we think we'll take about 20% of his time. He has 5 other professionals that work for him. Dan will continue to be the director of IT for the town and do those really hard, important things, like training our people, supporting our systems. And then between the two, we would hire a part-time IT tech support person to change ink cartridges, to hook up computers, to format computers, things like that. Things that require skill, but not at the level that Dan or Eric have. And we think that will free up Dan to do more work with those important issues. Then we will have Eric as a backup and redundancy, and they will cross-train between departments. They will learn each other's systems, things like that. And now, Dan, tell me if this is not true, we always help each other. Eric needs help.
And every week or so, I try to spend at least half an hour catching up with Eric, just
Right.
so the town and school are on the same board.
Right. So this accomplishes, and our goal here, my goal here, was not to save money. My goal here was to put together the right organization for IT to protect the town, to protect the schools, and to ensure that we keep good people like Dan and Eric and get a little bit more support. I think we asked for 26 hours, is that right, of IT tech support. So that would be, just a salary, no benefits, things like that. We think we could do that. The cost is reasonable. Dan had looked at, talked to a couple of outside firms, and to get somebody to support us full-time would be about $64,000 per year for a full-time person. The cost of this will be about $44,000, I think, additional to the town. So I think it's a really good idea. It gives us bench strength. It gives us people doing jobs that they're really good at and more of. And I think it's the way we should go. In this day and age, I'm really concerned about having just one person who knows all our systems. I mean, and Dan is on call. I talked to him this weekend. Dan is on call all the time. And that gets a little wearing too, right?
Can you pull up the budget lines, Marcia, and walk us through that?
The detailed workbook or the?
Yeah, like our regular,
Or your?
our
one?
budget sheet, just let's get to so we understand all the moving pieces.
It says draft.
Yeah,
Big
thank
letter.
you.
The purchase professional services,
Yeah.
we would not need that
No,
anymore.
no, that would be
because
the
that's-
outside company to come in and support us. And then when you do that, remember, you're getting an outside company. Knows the core systems, knows Word, knows how to hook up servers and things, but they don't know our systems in depth.
So where is this 44,000?
So-
Part-time wages.
48,000.
Okay.
When I did it the first time for Steve's
Oh,
budget, I
okay,
looked
yeah,
for
yeah,
everything in one
Yeah, I
line, and I
couldn't
thought,
find
oh, wait a
Yeah,
minute.
it wasn't.
Yeah.
But this is the schedule that kind of breaks it down, that I removed the one line, that here's the IT director, where we share
Well, he said 20, why is it 30?
20%.
We pay 20%.
Okay.
There is the shared clerk that we would share 50/50. And then we have some benefits, health insurance and social security type things that we would share, the same 20% and 50%.
All right, I'll speak to it. For me, this is a plan, and I'm on board. I mean, personally, that this is a plan that has been thought out.
Mhm.
You've talked about it, you all have communicated it, and I think, for me, yeah, I don't see any issues with
We did spend a lot of time talking about this.
We've talked about not IT, but we've talked about all the departments having a plan.
Yep.
And we've had issues maybe in the past a little bit with compiling a plan to support. And this is a plan,
Yep,
in my opinion. This
Yep.
has feet, this has legs, the table will stand.
yep, it will.
And it's thought out, it's combining what we've talked about is, trying to pool our resources as well on the
And
education
leverage those
side.
resources. Yeah.
For me, I don't see any of these numbers that, I know it's a first year too type
Yeah.
of thing of a plan, but I don't see any of these numbers that makes, that stand out to say, no, we're not doing this, or Nahid, I don't know how you feel.
I love it. I think you have to have redundancy, and IT is critical, it's the backbone, so I think it's a good decision.
Thank you.
Mary?
Yeah, absolutely protects the town, gives you maybe a little work-life balance in the future.
That's part of my hopes, yes.
Eileen?
Yeah, no, same thing. I mean, I think it gives you coverage where maybe that was trickier before, and, it's definitely, we've moved to a lot more computer-based stuff. I mean, a lot of the efficiencies in town hall are technology-based, and that needs the proper support, so, yeah.
And I know, like Steve mentioned, about calling over the weekend with the things happening here. There's been plenty of times where I've been in Florida or South Carolina
Yeah.
on my laptop because it's needed. So having Eric at the top end and a tech at the bottom end to help support both sides of my
Yeah.
workload, it's definitely something I'm looking forward to.
Brian, your thoughts?
Yeah, I mean, I think this is well thought out. I think that as I look at this, there is a risk on the IT side between the town and the school, and this was a good plan to close that risk.
It is.
It's an investment. At some point, we're gonna double back and look at the priority of all the investments. I hope this is high on your list of priorities of the
It's
investments.
very
we're
high
gonna
on
make,
my
because
list.
If we have to cut anything, I hate for this to be, because I think it's a smart thing to do.
This is the start of looking to see what other departments we can do as well and strengthen all of us here. And Steve and I have talked about this for years now, and Marcia as well. And I think Marcia made it very clear, a lot of these moves maybe not necessarily to save money, but they're to save efficiencies, best utilize our staff, and to put us in better, like you're saying, Brian, in better strengthening positions. So as we start to consolidate, Marcia, go ahead and speak to it. We were talking that you might not see savings.
So
It's more about, go ahead.
when I was in public accounting, we did auditing and consulting to governments and nonprofits, and the governments, the thing we would always say when they were thinking of combining departments was you can't think of it as a cost savings, and ultimately with more efficiencies there would be savings. So if you had two high-paid people and you combined, you might be able to have one high-paid person and a lower level at some point. But right away, don't do it for cost savings, do it for efficiencies.
Right, and I think that played right into what you were
Yeah,
saying.
yeah, I mean, in general, you can get economies of scale savings. This is not the size of the thing you're gonna get a lot of economies of scale, right? But the first thing you do is you combine, I'd say effectiveness more than efficiency, because managing risk, making sure we're effective is the big thing here. And then once that starts working well, then you can see are there any ways you can find some efficiencies, some cost savings, if there is any, but that's not priority one.
Right, and that's what Marcia and I talked about in the last few years with Steve not being here. And I know Steve and I talked about it earlier than that.
Yeah, we have.
So I don't see any issues with this. I think it's a good way forward, and I would support it. I think everybody else here would as well. So,
That's Dan, he's not. He
yeah,
wants
that's
to-
all right. He might be taking a
I
week
did
off.
not recognize that area code.
All right,
Rings.
I think we're good on this.
And do not disturb mode.
Daniel, thank you very
Thank
much.
you.
I really appreciate it.
There was one more.
All right, one more. Go ahead.
We had a
Maybe-
next priority
Oh.
form, and just trying to increase the timeframe for replacing the computers. That he's got a list of all the computers and when they
And
go
we
out.
pushed for this last year, Brian, so this is what we asked for.
Yep,
And yeah, if anybody would like, I do have the copy, the list of all the equipment under my management and how old or how far past warranty each of them is.
Just this summary is good. That means you went
Yep.
through it, and this
Pretty
is
much,
what we
yeah.
asked for.
Our oldest computer's from 2012, and this is basically the thought of, it's still going to be a while before we're at the industry standard of, like the 2 to 5 year replacement cycle. But this is the first step forward of being able to replace more each year, get rid of the oldest ones, have a spare computer or two for emergency crashes and things like that.
So this is putting us, I'm sorry,
Go ahead.
this is putting us on an 8 to 9 year replacement cycle?
At
with
the
this?
moment, it's getting close to it. A lot of it really depends on when we go to do the purchases, what we can get for rates. The
Right.
pricing I gave there, about $800, is not a top-end computer, but at least an okay one for an office use. Obviously, if we went a little bit higher in the price, we get something that'll last a bit longer, so at that point, that 8-year lifespan might not be as unreasonable. But looking back and forth on it, ideally, it would probably be something where we'd have $15,000 to $20,000 a year as a replacement budget to keep everything on that 2 to 5 year cycle. This $5,000 would get us up to $10,000 a year, so it's at least that first incremental step forward towards being where we'd ideally want to be long term.
Yeah, Brian, I don't know what, and Naheed and you guys, in my business, we were 5 years.
I was just going to say
JP
that.
Morgan,
that
they would
we-
just come take
If we
your
don't have the
computer
right
after 5
devices, we
years.
can.
Now, we could go 6, not,
We've got a whole new plan in place, let them come back to us next year.
Right.
We're gonna be the
And
same
come up
people
with-
here next year, let's get this 5,000 into the mix.
Yes.
Come back with us with a unified plan, because now it'll stretch across the schools.
Right.
We'll have the ability to buy maybe in more bulk too, or
and
whatever,
leverage, right,
do things, right, Brian, I mean.
Yeah, I'd like this in a little more
fine
next year,
tuned.
math. So
Right.
we
Yeah,
have this
me
many
too.
computers, if we're gonna try to get on a 5-year plan, does how many have to be rotated each year? If there's growth needed, how much is that? And so how many computers do we have to buy a year? And based on current rates, how much is
Yeah.
that? So.
And yeah, I had it slightly noted in here. One of the things too is that 120 computers right now includes, we have some people where they have a desktop and a laptop for remote work. Certain departments, they still need that physical desktop in the building, but as we start going forward to the replacements, rather than the $800 less expensive replacement, we might do a
Just
laptop with a
laptop,
docking
just a
station.
laptop.
Yep.
Yes.
And we wanted to do that for 2 reasons. One, for example, we lost this building for 9 days during the macro burst. Nobody could do anything. Second, during COVID, we had staff working half home, half here, your week in and a week out. We basically had no laptops. So I would like to see all of our employees who do that have laptops that they could take home and continue to work at
I can't
home.
imagine we're using desktops still.
I'm sorry?
So
Can't
I
imagine
would,
we're using desktops
I
still.
mean,
We
I
still
would-
have some towers.
we
You
should
know,
plan
for
just
at the
laptops.
counter, when people are checking in and want to pay their bill, that's fine, but we should move to all laptops.
All laptops.
For the
Yeah,
most
I
part.
agree, I think you're right, let's get the map next year, this is a great step forward.
Yeah, we will
We're
give you a
putting in a new
complete,
team,
Our
and not a new
inventory,
team, but a
or the
reorg.
year we bought, just the same thing that we asked for the trucks too, same thing. The year we bought, the
Yep, and
the
actually,
light that we
I'll give you a
have.
copy of what I have. This was basically my list of the 120 plus computers I have currently in our system. The far right column is when the warranty expired for each of them. Some of them were 1-year warranties, some were 3-year warranties, so it's a little bit hard to tell the exact purchase date from it. But for
We're
most of
gonna
those,
start
we've
keeping
got
track of that.
the basic age of that on them.
We're way ahead of what we were,
We
I
are.
think we're good, let's walk slow.
And that's why it was only the 5,000 rather than trying to jump from 5 right to 20 in 1 year.
So on board with this whole plan right now.
And then if you have
Absolutely.
like a laptop and a desktop for some people, then you
For
could probably
what I
just-
have in that file there is a column with the user. That's the last user that was logged into that device. So I didn't unfortunately have a. Narsha said I should have had a pivot table for you with it.
That's
So yeah,
okay.
so there
This
is.
is all for the
If
future.
there's
This is
one
all for the
user with
future.
2 devices, it is something.
Yeah.
Like I said, some departments, especially like say the registrars and the town clerk, there are systems that are locked where the connection has to come from the town hall building. So with a lot of them, we would still need a computer physically in the building. If they had a laptop from outside, they'd use that to remotely control the office computer in order to maintain that connection. But in places where it's possible, like Steve said,
Yeah.
getting the laptops for the supervisors, for
Yeah.
people that would most benefit from it, that's what we're
it's
planning.
interesting, like for our registrars, if they're working from home, they literally have to sign into the town systems here
Able to.
to get to the state, to get anywhere. And that's a good thing, that's a security issue, and we're very comfortable with that.
But this says if you got 120, maybe there's some duplicates.
Yep, and that's
Yeah.
all.
You
Like
gotta
going
get
through.
20 a year. You gotta get on a path of 20 a year.
That's like I said, the long term hope would be getting to that point. And as we start reducing the duplicates, consolidating down, I'm hoping we get that from 120 down to say like the 80 to 90 range, where we don't have the duplicates anymore. We have just a laptop with a docking station. At that point, then that automatically brings our time scale down for replacements.
Good, okay.
All right, well, thanks, Dan, appreciate
Thank
it.
you.
Yeah.
Thank you.
I'll give you this list.
Oh, I'll leave the pile here if anybody wants it.
Thanks.
Thank you.
All right, Steve, you're up.
Okay, I just want, Brian had said Glenda said last night, you know, okay, we're gonna have a long night, we've had long nights, keep it short. We've had more threats today. They are slightly different in format. They're still going through, dark web, anonymous VPNs. Our police, I had a meeting with the chief of police, CTIC, which is the Connecticut Technology Infrastructure or something Commission. They have officers assigned to that. He came down and we met with him. He's based in Bethel, in the Bethel Police Department, but he works also for CTIC. We had a long discussion, about an hour, about the threats that have been sent, their feelings of the threats, their ability, based on prior similar things, the level of the threat, and at this point in time, they do not believe these threats are credible threats. They still have to be looked at, every single one. We have to investigate every single one, which is happening. We have our SROs running through our schools again. Every morning, they're checking every single school. Everyone here is on high alert. If you see something, say something, even if it's something small. We don't believe these threats are credible. The threat we got this morning was sent to hundreds of universities, including every college in Connecticut. That doesn't mean that somebody wouldn't be doing something, but this is my opinion. You usually, if somebody's going to do something, they do it and then tell you about it, right? But that doesn't mean you can't. Our primary goal, keep our students safe, keep our residents safe, and we're going to continue to do that. We're going to be incurring some overtime. Okay, that's great. And that's what we're going to do, and we're going to continue to face these. But on the other hand, John Burrell and I made a decision based on advice from our chief of police and his team that we're not closing town hall. We're not closing the schools, because that's giving these people what they want. They simply want to disrupt your lives. That's my opinion. And so we'll continue to heighten sensitivity, and SROs and police presence will continue to do that. We'll continue to try, the police will continue to try to find these people. It's not easy. These people know how to remain anonymous. And we'll just keep moving from there, and hopefully this will die down. Because this sort of behavior is disgusting, in my opinion. There are not enough words to express my anger and dismay at these people.
You have our support, whatever you need.
Thank you.
From our side.
Our team, it really helps to have emergencies, because when we had the macro burst, we put together an emergency management team. We worked together. We had a few little hiccups, bumps here. This time, 15 minutes after we get the threat, it's interesting, the threat came into the town side, but the school side, they used Google. It blocked all of those messages. The school wasn't quite aware of it, because Google blocked them based on language, based on their criteria. And it came into one of our offices, and we immediately sent it to the police, sent it to John Burrell, and got it out to people who are over-communicating. And our emergency management team is working really, really well and coordinating with each other. With the threat today, we were able, in an hour, to assess it, to decide that it was not credible, and to get a message out to everyone. Because they're sending this to the news medias too. So parents are watching that like a hawk. And news media has no compunction about reporting, oh, another threat at Brookfield, and then mom and dad go crazy. And I understand them, they get upset, and they want to hear from the town. So we're able to respond very, very quickly, and hopefully this will die down. The second thing I wanted to bring up to your attention is a little more positive. I got a call from Jahan Hayes' office this morning. President Biden signed the partial funding bill on Saturday, and we have been awarded $965,000 for our radio system for the police. There are, so having a conversation, there are a lot of caveats in there. There are a lot of ways not to get this. There was New Britain got this award last year or the year before. We're going to use the award to take a building down. They took the building down before the award was actually presented to them. They denied them the award. We have to be careful with our radio system. I talked to them, I said, okay, we're starting with our radio system, it's not gonna be installed for months yet. And they said, okay, we think that's good, right? So we're gonna watch that really carefully. They're supposed to communicate with me in the next few days as to all the paperwork you have to fill out, things like that. And we're gonna be as careful as we can to make sure we meet every single requirement. There are some caveats, but that's a good thing. That's almost $1 million in bonding that we'll probably not have to do.
And you have
that's a
the
huge-
experience from going through like the Gursky grants and all of that, so you know what to look for. Remember with the Gursky, we
Yeah.
had a grant, but we did things that weren't quite,
Yeah.
we thought was right, but it turned into,
It may turn into we got a $50,000 grant about 12 years ago.
right.
14 years ago. And we didn't read the grant documentation. We gave the state of Connecticut for a $50,000 grant, complete control over Gursky for 10 years.
So that's
And
what-
they were in my office saying, I'm gonna go rebuild the barn at Gursky. I'm gonna have guys with axes chop up wood to create the girders. It's gonna cost you $1 million, because I'm gonna pay it and send you the bill. That's what the state said to me. Whoa.
That's what I'm saying. We have the experience
Yeah.
now to go
Yeah.
through this grant.
We
have
go through the
Marcia,
grants and
we're gonna go
make
through
sure-
it and
We have town attorney go through them to make sure that the codicils in the grant are not onerous to us. There usually aren't. It was just
No.
that one grant.
but to
But
make
we
sure that
learned our
we
lesson
fight,
on that one.
make sure that we follow to get the money.
And we have
That's
to
a big
follow.
help.
Yep. So that's the good news, and that's all I wanted to report to you tonight.
Marcia, your ball then.
I have no PowerPoint tonight, I was working on some of the things. And, but you've gotten the reports, there's no transfers for tonight. That we try to do those quarterly. There's no place that's of a concern that, as far as, that goes. So I guess, does anyone have any questions on any of the revenues, expenditures, budgets to actuals that?
We're still tracking all the positives, right?
We're still tracking positives, that there was a new revenue that that we might get next month, another $150,000 if a property closes and we get the blight fees. So that would be revenue. The Board of Ed is tracking on the negative. We're trying to pull money from wherever we can to try and increase that contingency. By next month, Ralph will tell me if I can take any of his salt and sand money.
It's looking good.
April 1st.
On the school side, you mentioned it, like, Steve had reached out and Eileen had reached out to me separately about, they have $179,000 of issues.
Well, they
No,
have a
$79,000
freeze they're
is
putting.
for-
Freezing, I apologize, I used the wrong words, I
Potential
No,
apologize.
not issues. They're trying really hard
So,
to stay under budget. And the amounts we have put aside, right, for contingency, those are what they are. But they want to make sure that they're staying under budget. It's critical. And they proposed putting a freeze in of $179,000. At this point in time, I think we as a town shouldn't do that. The things they're going to be cutting, there's a list, and Eileen has it and can talk to you about it. But these are things that, if we don't do them this year, we're gonna do them next year.
well,
I-
we talked about
go
this,
ahead.
Eileen and I, so I appreciate what you
Go
said.
ahead.
What I've asked, with maybe we get all of you to agree, is Eileen's gonna go back, because she's been our liaison to the business manager meetings. Go back and see what a real number might be, like it's at 100 and they can absorb 70, and I'm just throwing numbers out. I don't know anything, or if it might be the whole 179, but can there be some soft freeze, some hard freeze? What's the mix that will make sense instead of a full freeze? And I think Casey used the term frost in one of our meetings instead of a freeze. And it may be we have to help out the whole amount, I don't know.
Yeah.
But let's let Eileen speak with them, work with Marcia as well, and come up with a plan maybe here. And I know you say you're trying to grab revenue and steal Ralph's
Give us
salt
more
money,
contingency, right?
but let's get Eileen involved from here and get a plan with all of you, with Steve. You can, I'm saying Marty, you can
Yeah,
obviously
no,
be involved
Eileen
as well.
knows
I'm
this
sorry.
inside and out.
Because Eileen has been there, and let Eileen figure it out, maybe speak with the school to see what we can do, and then present it to us.
Yeah, it's just when I saw that, I thought, wow, this is
It's
really
too
early
early.
in the year to be putting a freeze on.
And
So,
then things
as
that
you
they
said,
they're just gonna be deferred they're gonna be deferred
Right.
purchases later on, their textbooks
Exactly.
and supplies that they're going to need
Right.
for the most part. So-
Let's take one more whack at it, all of you together, see what
And
we
then come
can
back to
do.
you guys.
And if we have to have a special meeting, if it's that serious, or you can make, we can put it off to our next meeting,
Yeah.
that's your judgment. And Marcia, your judgment as well of how you wanna handle it. So go ahead, continue. I'm sorry.
I'm done. The other part of mine was audit update, audit's done,
I wanna go back to the reports.
Oh, and we can go back.
I'd like to get a copy of that, please. Last time we got it, I haven't seen that since early January. So,
the
December.
Board of Ed numbers.
Yes.
Okay.
Are they someplace I can get, because
Usually they send them by email.
I've got the December one, I haven't seen it since.
I-
So
Well, I'll ask if they can send it, 'cause I got it as a printed out packet.
I don't mind it, just a printing, I don't care, just.
I might have had it. I might have
No,
emails
I don't
been
think,
messed
I'm
up.
not sure that it got sent out.
Bring up the revenue.
But we just
please.
had the meeting on Monday, so, or
That's
yesterday,
okay, just I'd
yesterday,
like
so.
a copy, I'm not
Yeah.
sorry, I didn't mean to, I'm not like
No, that's okay.
saying someone's supposed to be, I just would like a copy.
All right, revenue
Bring up
is
revenue.
number 5, I think.
Because this has been updated like now, so it's really the first line which you can't see there, but it says that the current year tax collector tax is projected to be under by 130,000, so this is the first time that we're projecting under.
Correct, and this is the first time we're projecting for the year, that, because we wait till after that February collections to do that. So our first projection is always at the end of February. So yes, this is the first year that we're projected under, based on the collections that we've had so far.
Do we know more about why? Is it, we're not billing as much, our collection rate's down?
So it
Because
would
we're counting on collection rates being the
Yeah.
same year to year, we're
Yeah.
counting a lot of things, right? We'll survive it this year, but we gotta make sure we have the right assumptions.
Correct,
next year.
it would all be with collection rates, and she doesn't feel as though they're down, as far as grossly down. So what will be interesting is to see what happens, because every month our estimate is that, that we will be collecting the same as the average of the prior
Right,
months.
so-
And so that'll be interesting to see on how we work out that, it's gonna be offset. I understand the issue with next year. The issue with this year is it's definitely gonna be offset with prior year tax collections, because
Right.
they're way up. But correct, that the percentage would be a concern for next year.
Right, I think for Monday, we're gonna need a view of, does what's happening so far this year change our assumptions for next year? And it could be, we think that prior year is gonna be better next year too, and the current year, the collection's gonna be down, so we'll wash whatever,
So
but,
basic, a time issue.
yeah, if that's what it is, but I mean, we can look at receivables and collection rates and all that, right? And get a,
We can.
we don't have to
and-
get this to the penny, but we gotta kinda get a feel for what's going on here.
Correct, and we can do that. And this was balanced through January because we closed on this one on February 27th, so we didn't have any statements in or anything. So and I can pull it through February 28th, 29th this year and see, update.
The bills are twice a year, right? The tax
Correct.
bills
Twice a year.
are, so,
And what's due in January?
Twice a year.
so.
July and January.
January,
That,
so.
And that's why we wait until after the January collections,
Right.
which are really due February 1st.
So they
do-
probably are,
Yeah, they have 30 days to pay it. February 1st, it starts to incur fees, and a lot of people come in at the end of January.
end of June.
And this is a little bit misleading, not misleading, but even if I were to give you this at June 30th, that it could say one thing and be another thing, because we have really with deferred revenue and modified accrual basis of accounting, it's a cash basis that we use from, that the rules require us to use, from September 1st to August 31st. So July and August of '24 are gonna have an effect on us here. However,
25.
from the 25 fiscal year,
Yeah.
yes. And so, I did go through and look at the accrual adjustments. One year I kept subtracting those out because I said, oh, those were outliers at the beginning of the year. I didn't think there were outliers last year, but that could also make a difference. It's 130,000, I think. So that might make a difference, part of it. But let me go through, let me update it to
Yeah, best
February.
understanding what's happening is on Monday,
Right.
we're trying to figure out how to
Yep.
close the budget. Thanks. I think that's what I have on the board.
Yeah, no, very good point, thank you.
Actually, I don't think I had anything else.
Printed in a notebook.
Is it my job?
That's a good question. All right, let's, you're done then?
I'm done
So.
with that.
Transfers were none, we already did that, so we're at a general budgets now. We went through the IT and the departments, I think we're all good with that. So where do we stand now, right now, like with what we've talked about, like, you
So
talked today with the EMS.
I talked today with EMS, that's gonna be quite a discussion if you want to start that.
Yeah.
Do we want to, can I just give an update on the Board of Ed? Because, I mean, we talked about, we glanced about this 179, just
Go ahead.
the number, the anticipated shortfall is actually going up a bit more. So we're now up to 615. And a lot of that is there are 3 special ed students, 2 of them that their outplacement changed as a disadvantage to us, and one that moved in and is a savings to offset it. So I did ask Rosa tonight if she can check and see if that's reflected in this this budget that we're reviewing right now. She said that they're waiting to see the final placement for one of them, and that will determine, so they will have an adjusted number at some point, but they think it might actually wash out that a couple students coming back in might offset the ones that have just gone out. So that number has gone up, which we weren't anticipating an increase that big from month to month.
But that's why we did this. 'Cause
Yeah.
nobody can
Yeah.
estimate this, and that, they could have had 3 more outplaced.
Yeah.
And that you can't budget for that at those numbers and keep it on the side. So this is exactly
That
why
was
we've
Dan's
done
point
what
last
we,
night
yeah,
too.
what we
and
did.
It's not stable numbers, and so, you know, if they find at the beginning of the year that there's a savings, and then maybe they wanna make that investment, you could have something towards the end of the year that jumps it a lot, cause that's so uncontrollable.
I even think once we had a child come in
But
December
We
that
get-
was special needs.
Yeah, it can happen anytime.
And all of a sudden, we went up
Everything
100 and
goes up.
something
Oh,
thousand
yeah, and
in that
honest,
year.
yeah, it's, the transportation is just as big of a cost as the tuition, it's kind of.
And as we discussed, I know you two knew, is they used to keep that on their side because they had to, right? Because if they didn't meet their budget, they would get hung out. And we've said we've tried to take those risks to the middle, and they're real. Nobody can predict how many students are going to be in, how many students are going to leave.
How
So
are other towns dealing with this? There must be.
Poorly.
I think they're
same
building in
stuff.
contingency into their school side budget and trying to manage it there, whereas we've taken the contingency to the town side. And that's actually why Casey reorganized this chart, that I'll get her to send this out to the board. But she put the special education tuition, transportation, spent excess cost revenue, and then the turnover savings in the top section, which are kind of the areas that we were anticipating using our contingency for. And then she split it out, like the other areas where they're having shifts in where the money is being spent, to just demonstrate where, you know, it's within, the athletic transportation, the substitutes and that type of thing. So format's gonna be a little bit different than what we had the last report that you saw. But I think it does demonstrate nicely, but it's kind of all the same pool ultimately.
You asked how other towns are handling it. The smaller towns have, when they outplace a student, it costs just as much, so, but they've got a $20 million budget, and now they've got a $200,000 exposure that, and so there is still, again, this year, which there's been a lot of years, proposed legislation for the state to take over this stuff, but it's never passed before.
But other states do that. New York State does that,
Yeah.
because our next door neighbor at our old house worked in special ed in Brewster, and she couldn't understand when our numbers were jumping, so I think she came to some of the meetings where there was a budget overage of like 400,000 before we had this model of having the contingency.
So one of the other things why we did it this way was to cut them down lean like we talked about, but then the process works where it's all transparent. So now the school has this issue. right? It becomes an issue that goes to the Board of Selectmen. The Board of Selectmen then talk it through, and then it comes to the Board of Finance. It is such a transparent expenditure that we try to keep the budget lean and then go through transparency. If it was all on one side, it's just hard to
If
go
it's
through.
all on one side, if it was on the Board of Ed side, they're gonna guess high as to what they think their special ed costs would be for that year. And most years, I think they're pretty close, but sometimes they're way under, and sometimes they're way over, and then they started digging into their other programs to make up for that. Bringing this special ed, Delta,
It's a
over
delta,
to the
it's not the
town
budget,
side.
right?
lets them just do their curriculum, do their teachers, do their teaching, and we absorb that risk.
But I think the point that Steve made one of these nights too was that right now we have a relationship with the boards that hasn't always been the relationship, and so right now it's working well. But if it's different people sitting at the table, we need to be careful that it's still set up in the way that that works.
Yeah, I think we just need a memo of understanding how this is working, so that future boards,
Documented, right?
Document it,
That's what you're saying,
and they may, a future board may decide, no, we don't want to do it that way,
yeah.
right? But at least the precedent is there, especially if we have a transfer year. We have an election in November, the budget's already set for that year, and all of a sudden the Board of Finance says, hey, guys, I didn't agree to that, right? So I think a memo of understanding, and I've talked to John Barrio, and I think he's gonna talk to his board, and we'll put that together.
Brian, your thoughts, you're sort of thinking about this.
Yeah, no, well,
Go ahead.
just a bit, it's from what we were talking about a day or two ago, right? The special ed, honestly, is pretty clean, right? It's because it's kind of number of students, it's names and the cost for those names.
Yeah,
right?
student one,
It's gonna
right.
get trickier with the teacher savings thing. right?
Absolutely.
Because there is a control, as you said, I'm just repeating your words, where you could decide to hire a less qualified person that's cheaper, right, to make your budget, or whatever. Or you could just say, I'm gonna hire the most expensive person that's overqualified because, wow, that's great, and if I spend too much, the town will make up for it. So that's a much more, you're slipping down the slope there, how do you really manage that? I mean, I'm
Agreed.
not saying anyone will do that.
I mean, I think where
But we
we've
just
seen
trust them that
this-
they're doing their job, right?
Yeah,
I just think
yeah.
that at one point we have to let go of the control and have them
We
have
have
the
no
control.
control. So
Well,
we
but
don't,
it's
we can't
their
let go of it, we
control.
don't have it.
But it's not ours to control. I mean, I think,
Yeah.
yeah. But, and I think they did justify, I mean, there are teacher shortage areas and, you know, they have to work with who applies for the jobs.
Yeah,
So-
but in the meeting yesterday,
Yeah.
these days run together, it was, well, if we don't know, you cover us. That says I have no accountability.
But they did
And
also
no
say that
control.
if they had two qualified teachers and one was cheaper, they would take the cheaper teacher.
This is, I'm on
Brian, no.
conceptual
And they don't
principle.
want to run over it, they're trying to do the best they can to stay to the numbers.
Brian, I get where you're at. I'm where you're at too. But I have really thought through this from my being here as long as I have. Is I'm so on your side of that. I spoke it at our tri-board meeting, right? But I think we got to put faith in that side and figure out a way forward. Otherwise, we're going to be fighting each other every year.
Absolutely. I mean, all I'm
And-
saying is in an MOU, if we want to do something like that, it's gonna be a little trickier than if it was
Absolutely.
just doing special ed. That's kind of my point.
I've stumbled down the same road you did.
Right, because
Totally.
just, hey, you know, I'll take the cut, and if I find some money, I get to spend it on whatever I want. That just shows that you're easily can get your thinking off track a little bit, and our thinking get off track the other way very easily too. So this is a area we gotta be
I
really
think
careful.
we're
not to do
protecting
that.
the town, they're protecting the kids. We are all doing, we have different perspectives, different seats, and that's probably that's what we hear that, but,
That's why we have boards. Again, Rosa spoke and Rosa spoke from the heart. And
Oh, yeah.
And I get it, but I think that's why our approach has been to put it to the middle and figure this out. And I don't know of a better solution, because other towns really struggle, and we seem to have managed this. And for the past 4 years, it seemed, even though we've had hurdles, and you've seen the trends, and you're a numbers guy, we've still managed to figure it out together, where the tax increases on the town have not been crazy. They've been all relatively in line with other towns, if not less. We have not put ourselves in a financial crisis of a cliff. We're weaning a little bit, but we're not cliff jumping. So, and I get everything you're saying.
And it's
I
working
totally.
really well right now, and the board's working together. You've all made the point, well, you can't tell what it's gonna be like 10 years from now. So if you're gonna try to codify a way of working so that's not gonna be a problem, that's gonna be tricky to do, that's all I'm saying.
It's absolutely gonna be tricky to do.
It's gonna be incredibly
Maybe we
tricky,
think
because
about
you have
our-
faith
After the
in,
season, maybe this.
Right, you're trying
Each
to
other.
codify,
no matter what you put on paper,
Yeah,
you
but
still have
there's
to have
still-
faith that people are telling you the truth, that they're giving you the right numbers. And I think we have built up that trust level between these boards, that it's there, that trust is there.
absolutely.
We have, and that's part of, we have the two of you now on what, for 4 years, right? So even after I'm gone and Dan's gone, and are you gone too? The four of us are gone. So then it's your ball to
You
carry.
back.
It's your ball to carry.
Wait, what?
So,
You're all coming back.
You come back, that's what you do.
so that's why that's even why we take the time to explain the history to you two, because you're gonna be here the next 2 years after, if we're not here. And that's why we do take the time to explain what we've done, what's working. And like I say, Brian, your question was totally valid, and I think the same way. If that point irks me, but then I speak to someone like Marcia, and Marcia says, Glenn, give it a chance, because they're trying to work hard, they're really putting forth the effort. Casey's really trying to do all the right things. And if you don't put faith in them, we're never gonna get faith out. And I learned from mentors. And thank you, Marcia.
And just one quick important detail, you said something about the students' names. No special ed names are ever divulged.
No, I know, you know what I mean.
Okay,
It's-
okay,
it's
yeah, just
Student
so-
A cost us this, student B cost us this.
Right, so they're numbered and, yeah, for privacy, we would never say
Right.
names.
Let's see where we landed. Let's go back to the budget. Where are we now? With all the things we've talked about, you've been keeping score.
So it hasn't changed. The only thing that has changed since we last looked at it was Brian had a really good idea that we were moving ARPA money, 90,000, and I put it in ARPA revenue and in cash spending, and he said last night that doesn't seem to make sense. It's not really cash spending, it's ARPA spending. So I just changed the columns, took it out of the revenue, changed the columns, same thing. As far as the budget, we are still where we were before. We're a little bit different because I made a little change today. We got the numbers in for workers' comp. Workers' comp is not going up at all, and 0%, it was 0% last year. And we got the numbers in for liability insurance. That went up a little bit, it was $700 or something. So that was just a small refinement, but other than that, nothing else has changed since we last looked at it.
Okay.
We're at 2.83.
So go to the education line. Sorry, I'm gonna say please, but I'll say it in front of now, please, and then.
And I'll use it for every time you
Yeah,
ask me.
please. Thank you.
You wouldn't go there.
All right,
What do we have? Did we make this to almost a 775, or is it the 575?
we are at, the number, 542, that is, their number of their original budget minus all the cuts,
We've been calling the perfect budget until we start
Right.
calling it that.
Right, so what cut level are we at? What number is that? The Steve's cut?
it's less than 575.
67,000 less than the Board of Selectmen budget.
Yeah,
Okay, so make that 775, just for exercise purposes.
all right, and then I'm just gonna do it here in red so I don't leave it in.
No, I thought that's too high, 775. Where do I wanna land, Brian? Was it
That was
775?
220.
You wanna add
You want
200.
Yeah,
to
220,
get, you
220.
wanted to get a total of 220 from the perfect budget. It's the 67 to get to Steve and then 115.
All right,
Yep.
yeah,
That gets you to.
So that gets you to 49, right? 499.
Yep.
perfect, all right. Now, let's go down, the EMS, let's go down to their line and see, what did we talk about today?
All right, EMS, it's gonna be a little bit of a long conversation, and I have to say thank you to them that they've humored me. We've both spent 50 hours trying to get together on this. And so I'm gonna give you a new budget workbook for just the salaries. I tried to clean it all up to show what it is. that we have the details of the salaries that we didn't have before. So we could look at that, but I think it's gonna be easiest if we just look at it at the higher level, at the summary, and all I did was make sure that the mechanics and the calculations worked. I didn't do any judgments of, oh, we should cut this salary, or this salary is too high, too low, that this benefit is right or wrong. So last year, at this time, we thought that they were going to be going with a outside contractor, as they always had, and they talked about it a little bit the other night. So the last time anyone saw their budget, it was based on an outside contractor. And then after we passed this phase, and the Board of Finance passed the budget, they made a change and they went to employees. So nobody has ever seen the employee salaries, nobody has ever seen the employee, how that's all put together. But it's in here. And so I call that the original budget, that they sent this to Tara, I think it was on April 5th last year. And if we look at the original budget, they have EMS staffing, that is the volunteers, they get paid $100 to be on call for 12 hours overnight, every night, so it's $100 times 365 days. They have their regular employees that are here, and that's their regular employees' pay, part-time, full-time, and on-call paramedics. They have extra hours, and the way that it was calculated was PTO coverage. When someone's out on PTO, they need to cover that, so they put the hours down. When someone is on sick, they need to cover that, so they put the hours down. And then they've got a category that was originally called overtime, but now it's called overtime, holiday pay, and activations. I learned today when talking to them, it's got a number of things in there.
Could have had a number of things in there, it's $1,000.
It's 81,000.
Oh, 81, oh.
Yeah, make it bigger.
I thought that was a dollar sign in front, all right.
And then employee benefits, that there's payroll taxes in the original, there's unemployment in the original, health insurance in the original, and a 401k in the original. There is no workers' comp in the original. They were going to handle that last year, is what they had said. So they had, the total of all those budgets was $1,456,770. What we had budgeted was $1,431,000. So they started over budget by 25,000, and I just emailed them tonight, and Andy has already got back to me to say, wait a minute, guys, I thought we were 11,000 under budget. It's this 35,000 that they're paying, but they didn't have it in their original budget that they gave us. What happened to that? And, oh, the fire department's gonna pay for that. Okay, but it wasn't in the fire department's bill either, it's the budget. So is it your extra money from the fire department's gonna pay? So I don't have that, he responded, but I have some follow-up questions. But that's the original budget, is, so 1.456. In April, but that's not exactly what they did. That as they're trying to put the pieces together, that we have this number that's called the working number, that of what they're doing based on this year, kind of an updated budget. That we hadn't gotten any updates from them from our end. Hopefully this new system going forward, where we talk quarterly, we could get those updates. There's been some shuffling of positions and time that, so the new budget, the new numbers that they're actually paying now is 52,000 higher than what they gave us in April. There's, they didn't add any coverage, that there is 610 more hours worked, but no more additional coverage. So that one we could probably get more clarity on. The employee benefits are the same. They didn't give me new working numbers for employee benefits, so those are just the same. So now,
So go back to, wait a minute, the unemployment line, how did you get from there to there, to 33,000 to 10? The town side is only, on the town side, our unemployment for the year is 10. Okay, sorry, my bad. I
we're at
apologize.
this column, but I can tell you how we got that.
And how did their health insurance not go up?
So this is the health, so this, we're still working in the same year. This is still
Oh,
the 2024 year.
got it.
One was their original budget, and one is
Were there
the
actually-
numbers, their actuals, except that they didn't give me actuals for, new actuals for, they just gave me the employees, that this one really is working this number of hours, this one is really paid this. And so I just carried over that, just so I could have a number at the bottom and have them line up. All right, so that's kind of where the story goes, so that, when we go to next year's budget, that, and we've had a number of generations of next year's budget, that this is the latest, the best one that we could get, and again, it's supported by price times quantity on each of the employees, that here are the figures. We've got PTO coverage, and they increased that because they said, oh, we should add more to that to cover the supervisors, for the PTO and sick time. We've got overtime, and then event standby, that's going to football games, going to things like that. They do not bill for that. Because I want to make sure if they billed for it, that we got credit for that, but they don't. That we have payroll taxes, again, these are their numbers, federal unemployment, Connecticut unemployment, we'll talk about that shortly. Health insurance, and they've put in all the costs now, and instead of the last one didn't have all the costs in it. And so that budget is 1.604. When we look at it, if we're gonna cut or not cut or whatever, the budget that we got in our last version in the Board of in the Board of Finance's budget that you're working with says 1,594,000. And again, the difference is that just trying to get the price times quantity, it was a little bit different than what they had originally given us. Their price was the monthly cost of payroll times 12, and we did this person, their pay times their rate. So
So it's a $10,000 differential.
so it's a little bit different. Not a big deal, but just why it's different. So then, let's look at the reworked budget. And this is just me making sure that I agree with the calculations that they gave me. That there's no changes on these calculations for the base pay. For the extra hours, that they had PTO coverage, sick time coverage, overtime, holiday activation, standby, and what I think has happened is that on these categories, they're looking at the reasons that they have overtime, the function, what is causing the overtime. But then, when you look at overtime, okay, what is this then? That's the object that they're buying, and I thought that there might be some double accounting there. That they were not really on board with that, but then I did this schedule. That, oops, wrong one. When we look at their payroll to date, that this is through December 31st, their ledger for payroll, for their W-2s. So this is 33 weeks, because they started May 1st. And then we prorate that, and you can see, and we compare that. This is the categories on that payroll report. This is the categories that would match. That for base pay is essentially what we're looking at. And it looks like if we prorate what they've worked so far, that their wages will be $1,046,000, and the budget is $1,034,000, the numbers for this fiscal year. So that's pretty close. But then here was my point that I tried to make, that if we look at the proration of all these extra time, it comes to $60,000, and their current year budget is $126,000, and their next year's budget is $162,000, and that's why I'm thinking that some of this is double accounted for. I gave them the schedule, I talked to them, and I said that I would like to recommend that we change that number to 60,000 instead of, or next year's budget, increase it by 5% to 63,000 instead of 163,000. I didn't want to do it all by myself. Andy agreed. Wayne wasn't sure. I said I don't want to bully you into this, but he did agree that, and we'll be monitoring it so that if that's wrong, that this is what the thinking was at the time.
Marcia and I went over this afternoon. We spent the two
Yes.
things today, threats and this. And I think Marcia is correct. And we still have money over in the contingency if Marcia's wrong.
Yeah, but what else, I said, is there any anomaly in these numbers? Like, did you not allow anyone to take sick time or vacation time or anything else in those numbers that would cause them not to be representative of a full year? And there's not.
So just make sure I got it, the column B, that's like ledger actuals.
Yes,
And then you're just prorating the next 3 months.
Yeah.
yes, by week.
And you said, so for the next 3 months, is there any reason why the trend wouldn't be kind of flat? Which, those months don't seem like they'd be
Yeah, or
uniquely high overtime for EMS. I
Economy's
can't think of
probably is
anything.
high.
yeah, or is there a reason why the first month
Sometimes.
wouldn't be
Yeah.
representative?
Yes.
Right, would be
Yes.
representatively low. Right,
Yeah.
okay, got it.
And so, and I think the cause of that is, and we
Yeah.
do it ourselves, that, when you're filing something that, okay, maybe you guys don't file by balance sheet category like I do, but when you're filing something, that if you've got something that, here is cash, and then you have something over here that here is the money for my vacation, that, okay, are we gonna go by the function or the object? And I think that that's what caused the issue, that, so,
So you think there's maybe $100,000 overstated?
yes. And I've asked them if I could cut it to 63, and they've agreed, and let's watch it quarterly. Those two go hand in
That's what
hand.
we agreed last night, there's nothing deviating from our discussion last night.
And then we look at employee benefits. This one, I just refined it based on the numbers
Are
that,
we still EMS or are we on a different topic?
we're still on the EMS,
Okay.
but we're on employee benefits for
Got it, yeah.
EMS. That, they don't appreciate that I like to see the calculations. That, this is what I've calculated, the gross pay minus the pre-tax dollars times 7.65. That, and it actually went up. Federal unemployment, 501c3s don't pay federal unemployment, and I've asked them to double check, make sure they didn't. The Form 940 would have been due in January, that they shouldn't have paid it. They haven't had any withholding for it. The employee never pays it, but they have withholding for the state unemployment. But they're gonna double check to see if I'm right on that. And then we've got Connecticut unemployment, and last year they paid 4,000 something that, workers' comp. The budget was just plain wrong for, the current year. I think they might not have realized that you pay it on the first X number of dollars of wages. So on a calendar year, last year you paid it on the first $15,000 of wages, and you pay it at 2.8%. There was an adjustment this year. Now you pay it on 2024. You pay it on the first $25,000 of wages, and it's 2.5%. And so I just calculated, they had 8,500, last year was 4,000. I did a calculation that they've got 11 people that are gonna make more than 25,000, multiply it out, just overtime from other people that haven't gone over, it's called a WAG, wild ass guess. That, yeah, so that's where I'm getting to, sorry,
That's a technical term, I know.
beep that out.
Yeah, I scolded Bob Zinsner last week about using that word.
All right, it's a technical accounting term. So that's where I got the $10,000. And that's higher than what they thought.
No, I was just looking at the 33, the number 33
I have no idea
in
where
there.
that came from. That was the number that they had put, and again, I don't think that they knew it capped.
That's fine.
But that's not an actual thing?
That's not an actual,
Yeah, that's
this
right,
is
that
the
number
original
34
budget and the
Yeah.
working budget, for the current year.
So it's 10 instead of 85.
Yeah.
Which I get.
Yeah.
I mean, it is
So, maybe in the interest of time, you've got this stuff down. Should we just go to the bottom line, or do you want to go through each individual line?
I gotta go to the bottom
Let's
line.
go to the bottom line. You've done a great job here.
No, I had to go through this.
No,
You're going through it.
You get paid to go through it.
That's what I do want to talk about.
Yes.
All right, go to what you wanna talk about.
Everybody didn't feel the pain.
Yeah, we're gonna feel the pain, sorry about that, Steve. Workers' comp, I'm nervous about workers' comp. They've offered to raise the budget. They have a quote on workers' comp. When I take the rate that our insurance company gives us for a paid ambulance person, times the salary, I get a number up into the 70,000s.
Where are they at?
They're at 48, and that's based on a quote that they got this morning, that for the next year, and we're using that. But my concern, and they're doing more homework on it, I've sent it to our guy to say, are they being scammed on this, or?
Or are we getting scammed on it?
It was low, it's
It
a lot
shouldn't be
lower
that
than.
different. Our
Yeah.
number and their
Yeah, at
number
least
should
say,
be
we're
No,
almost
I
the
know,
ones
we
paying
pay
more,
too
the
much.
town.
Oh,
The
yeah.
town paying too much.
I mean, there are more hazardous.
Never thought of that.
So we do have some follow-up on that, and my concern is that if it's low, are we gonna get an audit premium from a workers' comp audit a year from now or 2 years from now? But for right now, we're using the number that they were quoted and that their person thinks is a good number, so. And they
Is that
look at
like
the-
an official quote in a letter? So you're saying like an audit, as long as it's an official letter, how would you face an audit penalty or an audit if you had a legitimate,
Yeah.
I mean,
Well,
I'm
that's
asking. I
It's
don't know.
based on the payroll, right? So workers' comp is based on the true
Salary.
payroll number, whatever their number is.
So it's a payroll, and the state sets the rate, and they're saying they're getting discounts
Well,
for,
they're different, we do get different numbers.
yeah,
And I don't know, the variation seems to be big here, but
yeah.
I've seen it.
So that's just my concern, and they're looking further into that and make sure that that
Okay,
they're
so
comfortable.
your concern, what would remedy your concern right now? Like if you had a magic wand,
Waiting to hear back from our insurance guy to say, hey, they're being told this, and this, that they're gonna get this discount because they've got cameras, and they're gonna get this discount because of, they've been so safe. Does that sound out of line to you? And so that was it, and he answered part of my question today, but then I had to follow up. So-
When will we know that by? I'll get the
Tomorrow.
response back. Okay.
And then the concern I had, that the 401K, the employer match, is when they gave us the numbers last year, they were only giving a 401K to the employees that made over 1,000 hours a year. And they changed that, and now they're giving a 401K to everybody They're matching 4%. They believe they have 100% participation. So it's just, I just want to point out that was a change from what we were told originally to now.
Are you
Right.
allowed to do
What does
that?
the town
I don't
do?
think that
The town,
town's plan allows
technically,
you
if
to
you
do
work
They
20
have their own
hours or
plan.
more,
Oh, they have
you
their own
can
plan,
be
okay.
considered full-time.
Yeah, that's,
We're
Um,
going through that, but there, if you work, my understanding is if somebody works 5 hours a month, they would get the 401k match.
Correct. And then the other
And-
concern
Wait a minute,
is,
hold on, before we go back, just trying to understand it, Marcia, I appreciate it, really. How many do they have in that thing? I mean, is this one or a two, or what do we got?
probably, my best guess is we're talking about $6,500.
No, people,
People?
outside of the, well, outside of the 20 hour, our town rule is
1,000.
20 hours or more, you
Yeah.
get the four. How many of them fall out of compliance with the town policy?
There are,
Numbers,
so if,
people.
I would say that, I have it here because that's what we looked at. There are, oh, I didn't put the number. I think there's
11.
probably
11 full
another,
part-time
because there's
employees.
22 employees altogether, so it happens to be also 11. I think the
but the
dollar.
part-time could be 1,000 hours or less. We don't know exact, right, at this point.
So they gave us the numbers of what they're averaging, so, and we're only talking 6,500, but it's just a change from, that I wanted to point out from what they had said. I've got two other concerns, that the EMS, paying these EMS, apparently that they're charging these as independent contractors, and I've got some paperwork, and I have a link in here that says that what I think applies from the IRS is that they should be W-2s. When we give the stipend for $1,500, we're required to do it on a W-2, that I think those are also W-2s. They're following up on that. If that's the case, those then, we have to consider Social Security, we have to
All the
consider
taxes.
unemployment, we have to consider 401k, which would increase the numbers somewhat.
So if they are working for multiple fire EMS, let's say somebody works for Bethel and Brookfield in Newtown, then it's okay to do, from my understanding. They could still be a 1099, because bringing them on board is more taxes for the town.
So I
It's
agree with you
win-win.
on independent contractor versus vendor, but the rules talk about this being a stipend, and even though if it's a stipend, whether it's a stipend or hourly or salary, that they're talking about that it should be a W-2. So I think that they would just be an employee of multiple areas. But I understand what you're saying.
But this is not
I asked the
this is
same
not an
question.
expense, this is just following the law.
But it's a stipend.
Correct.
And that
It
makes it
would be an
sound-
expense if they turn into employees.
Right, but this is something that's not dictated, this is following the law.
Yeah.
In other words, what is the rules of this employment
And-
state? We gotta cover the rules.
Yep, and they're double checking with their consultant to
Right.
see if what I gave them is what they agree with.
This isn't a change, this is making it right,
Correct.
right? I mean, this isn't like we made a change to go from this to this. This is what we think it really is, and we gotta get it right, cost. They should be, if they should be W-2, and the
Oh,
rules
absolutely,
state
they
they're
should be
W-2,
They should be.
then we gotta pay the W-2, because that's what
Right.
it is what it
Yep.
is.
Correct.
Right,
Correct.
Brian, you understand what I'm saying, right?
Yep.
Yeah.
Yeah, and we want to make sure it's right, and so we have no surprises, no
So
having
the number
retroactive.
might go up a little bit once you get that understood.
Correct. So right now, from the original numbers that they gave us, the recalculated original numbers that they gave us, we're down 114. For what's in the budget, we're down 104. And it's really,
And they're pretty okay with this.
yes.
Yeah.
All right, so let's go back to the,
So 104, and it
thing
could
is,
get a little bit.
take 104,000 off their top line, just for the sake of,
So we would take it out of the contingency, and you may still want more details on this and be able to digest it before you move the money out from contingency, but,
this isn't a
This
move,
is-
this is an
yeah.
exercise, yeah.
yep. And so if we were to go to here, And if we were to go, I would say we would take it out of contingency.
That's fine.
You can just do it right at the top if you want, we're just doing a high level thing, right?
Yeah, she can take it out, I mean, if that makes it her accounting mind work, then take it out of
You're gonna get rid
contingency.
of it all after this meeting anyway.
Um,
And if you adjusted for, earlier on, you said there was a workman's comp at zero.
Yep, that
Is
is,
that already
up-
out?
that is already out up here someplace, way up here.
Which was that?
Nope,
Workers' comp, maybe you have it
uh,
Right,
Right,
oh, that was health insurance,
there.
sorry.
567.
So it's not.
8399.
So the health insurance you already put into the latest, correct?
I haven't updated dental, it'll be minuscule.
Okay, what about
And
like,
then if you're keeping track, 892 is added to liability insurance.
Higher, yep.
and what about like the fuel and electric have all been adjusted to
Yes.
regular? All right, so now, where do we stand right now?
What's the total-
3.43.
What's the total town number? This one's from town,
Total, oh, that's general
too.
government. General government operations is 22,743,144,
And what percentage?
3.67.
Okay. And the school is at what percentage now? Would we get that?
4.99.
Right, if I remember, okay. And then what's our overall landing point? 379? 343.
3.43.
343.
Okay.
Of
That number I like. Now, I think for tomorrow night, capital, we're gonna do some capital, just to prepare for tomorrow night. Dan had wanted to look at bonding less, and I think you were also on board, bonding less, or where was it? What would Dan wanna do?
He wants to
You two
bond
talk-
less,
Bond less, yeah, there's
Okay.
a bunch of stuff in the school,
yeah.
smaller things like $45,000 and less that are rolled into bonding,
Mhm.
and we wanted to move that as cash.
So I didn't know if they were trying to keep all the construction things,
I
you know,
think
in
that's,
one.
yeah, because the
basket,
useful life
but
was
yeah, there are
20,
some smaller
but it
amounts.
kind of goes against our rule.
Right.
Right.
Well, so.
Go ahead,
instead of-
speak.
Instead of guessing, the point was, we knew that it was basically one project, so that's why we just kept it as one number,
Yeah.
but, we need to have a discussion,
We're gonna have one,
yeah.
but I wanna set it up a little bit now to make sure that we.
So, now this isn't them, this is me, right? So-
Yeah, that's-
So, I'm not, I don't necessarily think we should be adding more to the cash
Yes.
capital. As a matter of fact, I think we should be taking a little bit out of cash capital.
Wow.
So I've done, why is that?
Yeah,
Okay, go to the, well, you don't know, do you have the summary? So we're at what?
343.
343. So, one of the objectives we could have is to get the mill rate to 3.2, which is what the Social Security COLA was. A third of the adults in Brookfield are over the age of 60, which means they're living partially or completely on Social Security. So, if we could get to 3.2, that would mean that the town's drain on them would be no different than it was the year before. And we're really close, right? From the numbers, I think if you take, call it $100,000 out of the capital number, I think we're there. So I've got a thought on how to potentially do that when we get, I don't think I'll do it in the capital review, I think we need to go over to what's in the capital, should we do stuff or not?
I'm listening, I'm
Yeah,
really,
yeah,
I'm
that's good.
concentrating, I'm
Yeah,
not,
okay.
I'm dazing, but I'm
Good,
listening.
all right, so
That's,
so we'll do the capital, make sure everybody understands what's in there, but then when we're in our, whatever you call the session, I can show you a proposal I've started on how we could take out 90,000 out of the cash. A little bit of cuts, a little bit of moving things around. I'm sensitive to Dan's point that we want to reduce bonding, and I think it's in principle, I completely agree.
right. His thought process was, since we're down to 3.43, do we remove some bonding and get it to cash and go maybe to 3.6? And at 3.6 is still a palpable number, and we've bonded less, and we're carrying more on the cash side.
So that'll be the debate. You know, again, my view, and I call it maybe a goal as opposed to a requirement. But I think that especially with the fact that education's gonna be at about 5%. If we could go out and say, we've got a mill rate that is equivalent to the Social Security COLA, it's the lowest it's been in a long time, I think that you can point to that as a very strong, very positive message to help cover the fact that there's a tough number to sell in the education.
So you're not bonding anymore, though, you're removing?
I'm gonna bond less.
Less, okay. Marcia, what are your thoughts?
It's a
My
strategy.
concern, and I'm sure you've thought it out,
Yep.
what happens next year? Because that's where the problem is, we lose $1 million, or 2 million, with the ARPA funding, and then do we screw them next year? That would be my biggest concern.
I'm not screwing anybody, I mean, we're gonna.
No, but
do the right thing. I mean,
Then
Well, does
do
the
we,
number
do
pop?
we
So,
shoot ourselves in the
yeah,
foot
I
for
don't-
next year?
Well, I'm gonna show you, I mean, I can show you now, but I'd rather have him.
No, we want everybody
I
here.
don't think what I'd propose impacts next year. What I would, you know, I'm gonna recommend a couple cuts,
Mhm.
which I think are
we're gonna-
cuts. I don't think they're push-outs, I think they're cuts. There's a couple little tweaks to reserves, but I think those are reasonable based on schedules. And then, another thing that, for example, in the bonding, there is about $500,000 for vehicles, right, which have a 20-year life. I think last year vehicles were financed on 10-year financing. And as a strategy, I think that makes a lot of sense, because if you can finance for 10 years, then the thing's paid for, and if you can, then you can reserve for the next 10 years, so when the 20 years is up, you've paid off your financing and you've reserved 10 years, and then you can buy the truck next time. So it's not as quick of getting to just pay for it when you need it, but from the position we're in, it's a really good strategy that keeps you on a to-go basis on those trucks. So that's an example. So again, I've been, because I was on the capital committee, I've thought a lot about this. I think this is a fairly long discussion that we can have when the time comes.
It's tomorrow, I mean, that's why I wanted to sort of set it up tonight.
But I was
a little
thinking,
bit.
again, with the capital committee and all that, I think we just go through the line items, make sure everyone knows what's in there. This thing is really more, how does it fit in the bigger picture kind of discussion?
Well, that's why I wanted 3 of you here, like from the capital committee. In other words, when we're going through this and one of us says, let's throw this out, then you can say what your thoughts
Yeah.
were, Ricky and Ryan can say what their thoughts were, and it becomes a consensus. And that's basically how we've run this board. It's not again, a slight on anybody, that's just how we've run this board and trying to get as much information from different sources. Because your view, which is very valid, and I listen to it, so it makes a lot of sense. But Dan's view also makes sense to me, and I'm only one vote. I mean, don't get me wrong, I'm one vote. But I think we might, you have to listen to both and think
Absolutely.
about
I
it.
agree with Dan in principle. I think that maybe he's trying to get there a little faster than we can afford to get there. That's
Yeah, that's
I
possible
agree, I
too.
completely agree in principle. If we were where he wants to be, that'd be a great thing.
We have, and you're right, and you've looked forward to it, but that's been our principle along with, Marcia and I have really sat down a lot of hours on this, as well as what's next year and the year after look like,
Right.
because that's really, when you break it down, and I had the numbers here, I don't know, I did an analysis. Do you have that? You might have it in your files with the mill rate analysis. Do you have that in there?
I'm gonna give you control.
Oh, I don't know if I want control.
Someday you're gonna have to invest in getting one that works on my machine, because I wanna have,
Oh,
I do like having
I
it.
I could just bring my,
Oh,
my
I-
MacBook.
What am I
I
doing with
think I have an
this?
adapter downstairs in one of the other conference rooms. I'll bring the adapter and leave the one up here for it.
That'd be
Because the zoning board of appeals uses an iPad for their meetings sometimes, so I'll put the spare adapter up here for you.
Oh, the adapt, that's it, okay.
Yes, it's, you're used to it when Alan had his iPad up here.
And as you're doing that, Steve, this gets probably way more to you, right? I mean, if you wanna say, look, we're gonna go with, we think 3.6 is the right kind of mill rate increase for the town, and that's what's right for the town, that's fine. If it's, my thinking is, I think no one would argue that 3.2 would be a really good mill rate. not
Well-
sacrificing the future.
I agree with you. No one would argue with the 3.2.
Yep.
The logic behind that is good.
Am I plugged
But
in
in
or
the
no?
year when you have to come
What
in
is this
with a
now?
3.9
Both sides.
or 4.0, and
Both-
there is a
both.
2%
That goes into
increase
USB.
in social security,
Wow.
people are gonna say, wait a minute, you promised me you wouldn't go over
You can't
my
say that
increase.
the current.
No, people will take that as
Well, you gotta give
an
that- we're not
implicit
promising.
contract.
Right.
So we have to be careful how we word
I
that.
frame it if you want to do it. So,
Yeah.
you know,
My other thought is, I don't know how much people, there's a core of people that do listen to the numbers and the justification of it. There are a lot of other people that just show up and vote yes or no. Without, they're either, I'm gonna pay what it costs to run the town, or if there's any increase at all, I'm going to go to town.
Yeah.
So I
Okay.
love the idea of actually
What am I
educating.
doing wrong?
It
No,
takes
it's
a while
not
to
done.
boot up.
All right.
They just haven't
So
thought
what
through
is
it.
our
Not
current
rational.
mill rate, Marcia? It's 28.86, right?
No, 26.89?
26.86.
26.86, 26.86, right?
Yeah.
And then we just talked about we're gonna increase 3.43, right? 3.43. So, looking at this, and I think we looked at a number before of 240,000 is about the average assessed house. It's probably gone up a little in the revale, but it's just 2/3. That's the house value is 360. Your taxes with this increase would go up $221 a year, $18.43 a month. That's what the net on what we're doing is going to do. As you get higher, obviously in the numbers, it goes up. But if your house was, this is big numbers now, right? So if your house was valued at 600,000, your net taxes is going up 553 roughly. So I mean, when we're trying to reduce and get the numbers, understand that sometimes the numbers don't really move it as much as you think on a monthly basis as well.
oh, I don't know. I mean, we're talking about taking $90,000 out across the base of a town. It's not going to change these numbers.
That's what I'm thinking, right?
But no one's getting to, that's 3 levels down on the
Yeah.
number, right? I mean, I'm trying to get to a very top level, easy to explain number, right?
I'm just saying, people start sending things around. You raise my taxes 0.5%. That's going to cost me $1,000 a year, and it's like, no, it's not. It's
Yeah, it's
this
not
is
even
the reality
yeah,
of this
yeah.
is, I know we're trying to get to a number we think is going to pass. And I always like to look at this at some point and say, the true impact of what we're proposing right now for the average homeowner
Right.
is $19 a month. Now, I know on some households, you're right,
That's
we'll
it.
stress it and it's a lot, but as a general rule, it's not
Yeah, I just did it the other, and the soundbite I have is a third of our adult taxpayers are 60-year-old.
yes.
And so Social Security is a big chunk of their income.
And then
Of
if
many of their income. Some of them don't care, right? They're working, they're making a ton of money.
Yeah.
Many of them, that's a good chunk. And so not growing our taxes any faster than for at least 1 year. I got your point, because you can't guarantee it. You have no idea what coal is gonna be in the next years.
I
And
think
maybe
we
you don't even
also,
wanna link them because
Right.
there's that thought.
you know, when you talk to people, particularly people from like the shores, they saw a huge increase in their taxes. The average
On the
house in the
revale.
shores
Right.
went up almost 3 times what the average house in the town went up in the last reval.
Well, and
Okay.
the one before that, because
Hold
of the
on.
macro burst.
Right, no, but I did a study on that too. And if you look at the 2 last revals, the majority of houses on the lake, even with this increase, are paying less than they were on the prior one because of the way it caught up, percentage-wise. So in other words, their reval 10 years ago, they were the lowest increases in the town. This year, they were the highest. So if you average
I
out
see what
over
you're
the
saying.
10 years,
Yeah.
the analysis that I did
Okay.
is it's not quite what it shows.
Yeah, okay,
So-
but that's what people look at.
I'm just telling you,
Right.
but prior
My
10
taxes
years,
went from
they
6,000
were the
to
ones that
9,000.
went
Just
down.
remember the short term.
I call
You're
that the
right.
Saluga rule. Saluga came to us on the last reval and said, why did the lake properties go down 10% in their
And mine
revals
went
and
up.
I went up 20?
Yeah.
And then now the lake went up 20 and that property went down to 10. So I mean, it just reversed over the reval.
I'll give you, in the last reval, my house went up about 4%. All my neighbors went up like 15. But in the reval before, my house went up 18% and all my neighbors went up about 8. So over time, I think it does even out. And I probably should have not the last time, but the time before, gone to the BAA and said, hey, I don't get this. I live in a pretty homogeneous neighborhood, right?
Look, this is a rebuild year,
So,
that-
Glenn,
that
you
will not
raise,
cause any-
you raise a very, very good point,
Unplug
that
this
probably
here.
over the last 3 revals, the average price increase has been,
Yeah.
but you have to take out the shorefronts. They just go, they just go through the roof.
Yeah.
But you're right,
All right, I did one on somebody's property because it was and their 2020 assessment was, wait, let me breathe out this. Now, I'll bring it up the next one, the next meeting. But the analysis came out where a person who said that they were way out of whack. If you took it over to 10 years, it would be less than the average going
you
up.
can't really argue with that.
So you can't argue.
But what they see though is only the last reval, and they see what their actual taxes move in the last, after the last reval. Whether that's right or wrong, it's hard to get people to go back 2 revals and say, hey, everybody else got whacked 2 revals ago, more than you, and this time you got hit, right? And this happens. That would be interesting to see. I think I'd like to see that, Glenn. I don't remember that. I'd like to see that.
Maybe to.
All right, here's the analysis by year. So this household in 2015 paid $12,000 in taxes, $12,423 in 2015. In 2021, that household only paid $13,958 over 10 years. Not 10 years, but 1, 2, 3, 4, 5, 6, 7 years of increases. And you're talking 20% increases and stuff. That's what I'm saying. The analysis shows if you followed it.
That's
Uh,
really interesting.
12,423.58 in 2015,
Yeah.
and then 13,958, and that was a lake house. And if you really go through, the average over the 6 years of increase on this house was 2%. 2%. So over the big picture of the mills bouncing back and forth, this household was 2%, less than the tax.
So they did better than the average tax.
That's what I'm
increase.
trying to say.
That was your assessed value or the taxes?
This is the taxes for the
I
tax
think the mill
bills.
rate's been around 2% growth
Yeah.
over the last 10 years.
Yeah,
It's
but Glenn's
probably
point is,
consistent.
our tax increases have been somewhere in the 3.5%
I have that
increase.
history.
So you would think that house's taxes would go up 3% per year.
All right, the
They
history of the
did not.
tax increases from 2012 is 2.41%, in 2013 is 2%, 14 was 3.5, 15 was 1.18, 16 was the flat line, 17 was 2.72, 18 was 1.79, 19 was 3.85, 2020 was 2.82, 2021 was 1.75. So yeah, it's around 2. That's what I'm trying to say. So it falls in line. And maybe not under on this house, but I'm saying it still falls in line and tracks
Yeah.
with the revals and the 2 revals equaled out
Over time.
over time.
So, I know you're saying, just the last thing that made me think this way, just to be complete, is we had the woman in here that runs the pantry thing.
Ellen.
And she said, we're getting so many more people there, and it's seniors. So
Yeah.
it seems like if, for people that are maybe younger working, maybe they're, the place where maybe they're struggling the most is that area. So that's why I connected that with maybe we should be thinking about the Social Security.
I
COLA.
think you're absolutely right. And most seniors are on a probably 60-80% fixed income. They might have some other income. The inflation on other things, just going out and getting
Right.
The food
pizza,
itself is
Right.
gone.
is
So ask them
really
to-
whacking
We
them.
know all that's going on, but also please pay more on than the fair share.
Your
on
electric
taxes is a
bill.
very tough
Electric
ask.
bills.
Yeah, but
Right?
the thing is that it's so hard because the town also is paying more in terms of electricity,
Yeah.
fuel, everything else. So it's a balancing act that's really, really hard.
We were close. When you're 3/4, it's not 2/4.
I mean,
It's not a big number. That's why I said, maybe there's something possible.
One of the other things, and I'm trying to get to it now, which speaks to what else you're saying, and I don't know, is the amount of free lunches and reduced lunches. And we didn't talk about that number as well here. but free and reduced lunches went to $663 this year, and the change to date is plus 70 from last year. So that also
That's 10%,
shows that we're on the lower end of things. We're also struggling. On the senior end,
Yeah.
I get it, but also on the lower end,
Right. I mean, I,
Let's see your numbers tomorrow.
yeah, and I think we do got
Yeah.
maybe one more look at, so what do the next couple years look like? Because you showed us the 10-year model really quickly, but that had some very gross assumptions, like 1% grand list increase, where then we said we got hundreds of millions of dollars, 140 or something coming in, which would be well more than 1%. So I don't know if we got a problem or not. That, we should look at that. But this was not, I don't think this creates any much more. I don't think we pushed anything out for us. We'll talk about it tomorrow.
We would make that motion today, to set the town budget public hearing.
Oh, okay.
Let's do it.
So what do I have to say?
We can't leave here without doing that.
18 to 20
All right.
projects coming up, so.
I would like to make a motion to set Wednesday, April 3rd, 2024 as the date for the proposed FY fiscal year 2024-2025 town budget public hearing. Do I have a second?
Second.
All right, Dan usually does this for us, right? Isn't this the one Dan does?
Yeah. Yes.
So Marcia, you're gonna work, because he's the best presenter of all of us, so, or for that we know of, I'm not, but Dan has done it for years and he really does a great job.
Yeah, he does.
So, all right, all those in favor? Aye.
Aye.
Perfect. All
And we're
right,
doing the capital the same night, right? So we don't know yet who's going like at 6:30 or 7 or 7, figure that out.
right. So tomorrow night, we're gonna do capital. Ricky and Ryan are coming. We're gonna finish capital. Then we're gonna walk through this, and we'll go through your scenario, Dan's scenario. Then we're gonna walk through this one more time. Use a general thing. Think about any changes, additions, subtractions you wanna make. I think the revenue line, we're good with. We weren't weighing anything, right? On the revenue line, we agreed to that last night, right? Pretty
Unless
much.
for some reason the fact we're a little under this year changes.
We're gonna
the
find that
assumption.
out, right? And then we'll walk through, we pretty much got an overview of the departments, we'll walk through the departments and get a general of where we're gonna land. Take the weekend, think about it, Monday, come in, finalize it, and be done. Everybody good with that?
Sounds good.
All right, I'll make a motion to adjourn.
Second.
All in